Materials needed.
Stethoscope. Sphygmomanometer.
Have the subject, client, patient, or individual either position themselves supine, seated, or in a standing position before taking blood pressure, preferably in a seated position. In a seated position, have the subject's back rested, feet flat on the floor, and bare arm should be flexed, resting at the level of the heart. If the subject is anxious, wait a few minutes before taking blood pressure. For a more accurate reading, it is recommended that you take blood pressure on the left arm. Procedures: inspect all the materials before use and make sure that they are in working condition and clean. To begin blood pressure measurement, use a properly sized blood pressure cuff. The length of the cuff's bladder should be at least equal to 80% of the circumference of the upper arm. Wrap the cuff around the upper arm with the cuff's lower edge 1 inch above the antecuboidal fossa. Make sure that the stethoscope ear tips are facing forward. Gently tap on the diaphragm portion of the stethoscope and ensure the functionality of the equipment. Lightly press the stethoscope's valve over the brachial artery just below the cuff's edge. Make sure the air release valve is properly closed. Tighten it to the right. Squeeze the inflation bulb to inflate the cuff to 180 to 200 millimeters of mercury, and then loosen the air release valve to the left to release the air from the cuff at a moderate rate of 2 to 3 millimeters per second. Listen to the stethoscope and simultaneously observe the sphygmomanometer. The first knocking sound, korotokov, is the subject's systolic pressure. When the knocking sound disappears, that is the diastolic pressure, such as 120/80. Record the pressure in both or either arm and note the difference. Also record the subject's position, whether it was supine, standing up, or in a seated position, and which arm was used, and the cuff size, whether it be small, standard, or large, adult size, or pediatric. If the subject's blood pressure is elevated, measure the blood pressure 2 additional times, waiting a few minutes in between measurements. A subject's blood pressure of 120/80 millimeters of mercury or more requires immediate attention. Subjects with systolic blood pressure less than 120 and a diastolic pressure of less than 80 are in the normal blood pressure range. Subjects with systolic pressure between 140 and 159 or a diastolic pressure of 90 and between 90 and 99 are considered to be in the classification of stage 1 hypertension. Subjects with systolic pressure greater or equal to 160 or a diastolic pressure greater or equal to 100 are considered to be in the classification of stage 2 hypertension. And that is how you take blood pressure. Have a great day.